Can facial fat transfer replace facelift? Well, this is an interesting question, and I'll try and make you understand how fat grafting and how facelift both work. Now, when we are talking about volume loss and more of volume loss than facial sagging, then fat transfer is a good option to achieve a fuller and a more youthful face. But if we compare it to a person who has more laxity and not a lot of volume loss, but rather a volume shift to the lower part of the face where the jowls start looking heavy, the nasolabial folds start looking heavy, then the laxity problem can be solved by replacing that lax tissue upwards, and that can be done by a facelift. We often combine facelift and fat grafting because aging is not unidimensional. Laxity also happens and volume loss also happens. But when we talk in terms of individual patients, we really have to assess whether it is laxity which is playing a major role in the aging of the face or is it volume loss. So when we are doing a facelift surgery, what do we really do? We put hidden incisions around the ear, and that helps basically to gain access to the internal tissues where we actually pull up and tighten the internal smash layer, and that makes the face look more youthful. It gives us a highlighted cheek contour, the jowls are gone, and the excess skin can be removed. This can definitely not be entirely replaced by a fat transfer when we are looking at an advanced laxity of the face. Now, why facelift is called the gold standard anti-aging procedure? Because it replaces the volume where they belong. But when we talk of patients who've lost a lot of volume, and they often come and tell me, the doctor, when we had a fuller face, we used to look very youthful and young. But after weight loss or maybe after aging changes, our face has sunken and now we feel that we have aged more. But when we assess, there's not a lot of laxity. So in these cases, I would like to do a fat transfer to give them the fullness back in their face so that the youthful face can be achieved. Now, a major difference between the two procedures is that fat transfer is done by very small needle pricks. The fat harvest is also done by very small incisions where we suck out the fat, and the injection is definitely not done by any cuts, but it is done by small holes which are small needle pricks and through which we can inject the fat. We do a lot of full face fat transfers where we cover the areas of the forehead, of the scalp, this temporal area, the above the brow area, the eyelid, the lower eyelid area. Even when we are looking at very hollowed out or sunken eyes, even on the upper eyelid area, we can put fat. In this area, in front of the ear, where we see that it has sunken in, that can be grafted with fat. Chin can be fat grafted. We can also address the nasolabial folds with fat grafting. So obviously, there has to be a strategic placement of the fat, which leads to a youthful look, but not an overtly bulky face. So obviously, there has to be a balance of fat transfer and a lifting technique when we are looking at rejuvenating a face completely. So that's your answer, that it cannot be said that fat transfer will replace or is replacing facelift entirely. Each case has to be assessed on its individual merit. If you're looking for anti-aging solutions, be it surgical by a facelift or a fat transfer, or non-surgical by various facial tightening procedures, thread lift or fillers, you can definitely consult us. If you have questions regarding any anti-aging problems, then you can definitely ask us in the comment box below. We'll be very happy to answer them. Do like and share this video with your friends, and do subscribe to our channel SB Aesthetics. We post very interesting information about plastic surgery, and skin related information are also available.